Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Our laboratory today about introduction to practical toxicology. Toxicology, as we know that pharmacology is the science study the mechanism of the action of drugs, the therapeutic uses of a drug, and the side effects of drugs, while toxicology is the scientific study of adverse effects that occur in living organisms due to chemicals. It involves observing and reporting symptoms that arise following exposure to toxic substance. The person who study the pharmacology called pharmacologist, while the person who study toxicology called toxicologist. Toxicologist will investigate the mechanisms by which these substances exert toxicity, as well as how to detect the presence of these substances in various sample types and how to treat the poisoning, meaning that the toxicology not only responsible for treatment of poisoning, who responsible for study the mechanisms by which of these substances exert toxicity, as well as to detect the presence of these substances in various sample times and how to treat the poisoning. So the toxicologist mainly focus to get following important information about poison: detection of poison, occurrence of poison, properties of poison, effect of poison, and the treatment of poison. What is the poison? How can you define poison? Poison is any chemical which is toxic and can cause serious health hazards. It may be toxicant, toxin, or poison. Toxicant, substance that produce adverse biological effects of any nature, may be chemical or physical in nature. Effect may be various type, acute, chronic, while toxins, specific protein produced by living organisms such as mushroom toxin or toxin, most exert immediate effect. يعني إذا انفرزت toxic substance which is a specific protein produced by living organism called toxin, while the poison toxicant, which it is chemical substance that cause immediate death or illness when experienced in very small amount. Even exposure to very small amount may cause immediate death or illness. What are the types of toxicology? There are many branches of toxicology: analytical toxicology, applied toxicology, clinical toxicology, veterinary toxicology, forensic toxicology, environmental toxicology. Analytical toxicology علم السموم التحليلي. It is a branch of toxicology which deals with the study of detection and assay of poisonous chemicals, including their metabolites that could affect the biological system. While applied toxicology, it is the application of new and modern methods or technologies for early detection of toxicants in the field or setting or practice area. Clinical toxicology, which it is the most important branch of toxicology. مثل ما احنا نعرف clinical pharmacology علم الأدوية السريري هو أهم branch of pharmacology. Also, clinical toxicology, which it is the most important branch of toxicology. It is mainly involved in the study of diagnosis and the treatment of poisoning that can affect humans. Veterinary toxicology. Veterinary toxicology focus in the study of diagnosis and treatment of animal poisonings, including the transmission of toxin from animals to humans by milk, meat, fish, and food and others. يعني, responsible for study the toxic substance in animal. Environmental toxicology, it is a branch of toxicology in which study of the presence of different toxicants, including their metabolites and degradation products in the environment and their effects on humans and animals. It means that if there is any toxic substance present in the environment and what is the effect of these toxicant in the human and animal, not only the toxicant, also their metabolites and degradation of products. Forensic toxicology, also it is an important branch of pharmacology, which it is responsible for the study the cause of the death. يعني يدرس سبب الوفاة is the use of toxicology and disciplines such as analytical chemistry, pharmacology, and clinical chemistry to aid medical or legal investigation of death, poisoning, and drug use. يعني علم السموم الفورنسيك يعني العدلي يدرس the cause of the death or the cause of the death causing by medical يعني خطأ طبي or legal or illegal مثل جماعة خلال الانتحار or use جماعة المخدرات. What is the cause of the death? Factor affecting toxicity, dosage, such as acute or chronic, acute, single large exposure, chronic, small continuous exposure, acute means single dose for very large exposure, يعني an overdose. Sometimes chronic, small, continuous exposure in low doses for long period of time. Route of exposure, either ingestion, inhalation, skin absorption, skin contact, lead to skin absorption. Age, if the person child, adult, or elderly, this is effect in the poisoning. Sex, male or female, health and individual characteristic. If the person suffer from other disease such as renal or liver disease may affect in the poisoning, not lead to excretion of poison. This lead to increase the toxicity. What is the difference between side effects and adverse effect؟ احنا ندرس نقول side effect and adverse effect, but what are the difference or between these two side effects and adverse effect? Side effects are effects, undesirable effects seen on the side in clinical use. These effects occur at clinical therapeutic doses. يعني احنا بننطي دراج اني دراج ننطي بجانب استخدامه الكلينيكال يظهر undesirable effect. هذا ال undesirable effect يسمونه side effect. This is undesirable effect occur at the therapeutic dose. احنا ما نعطينا بجرعة عالية، نعطينا بالثيرابيوتيك دوز وتظهر بهذه side effect which it is undesirable effect. These side effects sometimes can be used clinically as a therapeutic uses. For example, مثل ما تعرفون الألارمين which it is diphenhydramine. الألارمين antihistamine. One of the side effects used in allergy. One of the side effects of this drug causing drowsiness and sedation. So some person use of these side effects clinically for induce sleep by increased blood drowsiness and sedation. Another example, metformin تعرفونه can be used for treatment of type 2 DM. One of the side effects of this drug causing anorexia decrease appetite. So this side effect can be used clinically in the treatment of obese patient by decrease appetite and lead to decrease in the weight by affecting in the leptin hormone. أكثر شيء يستخدمونه for decreasing the weight in the treatment of polycystic ovaries. Also, other side effect, atropine. Atropine, one of the side effects causing tachycardia. So can be used this side effect for treatment of bradycardia causing by cholinergic drug or by another drug. This is about the side effect, while adverse effect in contrast are any undesirable harmful effect or that cause undesirable outcomes. يعني بالنسبة للadverse effects all the time has harmful effect, and this adverse effect has no clinical therapeutic uses. يعني ما أقدر استخدمها كclinic for treatment of other disease. Also, this is the adverse effect maybe occur in overdose. مثلا إذا drug causing convulsion or causing cardiac arrhythmia or may cause seizure or cause anaphylactic shock. All these considered as adverse effect, not as side effect, because cannot it is all the time has harmful effect and cannot be used clinically. Classification of chemical interaction between drugs or toxin, either additive effect, potentiation, synergism, and antagonism. Additive effect, combined effect of two chemicals is equal to the effects of each toxicant if given alone. يعني إذا ننطي two toxic substance وحدة تأثيرها one and the other the second is 2. إذا نجمعهم ننطيهم together التأثير راح يصير 3 is the summation of the effect of each toxicant if given alone. While potentiation increase effect of toxicant acting simultaneously with a non-toxic one. إذا ننطي two substance وحدة ما عندها تأثير سمي 0 والثانية مثل تأثيرها السمي 1. إذا ننطيهم together This is non-toxic cause potentiate the effect of toxicant substance. راح يقوي تأثير المادة السمية فما reach to 3 or 2 or 3. Synergism, an interaction between two or more drugs that causes the total effect of the drugs to be greater than the sum of the individual effects of each drug. A synergistic effect can be beneficial or harmful. إذا طيب مثل تو سبستنس، واحدة تأثيرها السمي 2 والثانية 2. المفروض من نجي إذا نعطيهم together ما راح يطلع لنا 4، يعني السميشن راح مثلا يوصل إلى 10 تأثيرهم if given together. يعني التأثير of two drug is are greater than the sum of the individual effect of each drug. This synergy may be beneficial or harmful effect. Antagonism, interference of one chemical with the action of another. يعني وحدة تتعاكس opposite the effect of other drug. Either competitive antagonism or other. This type of antagonistic agent called in toxicology antidote. So many of the drug or toxicant having toxicants have antidote used for treatment of poisonings. Thank you very much for your listening.